Dr. Emma Hayes, you're blocking my surgical corridor. Dr. Richard Bennett's voice sliced through the hallway like a blade through tissue. His tone carried the kind of superiority that came from 25 years of being chief of cardiovascular surgery at Sacred Heart Medical Center. Emma moved aside without speaking, her blue-grey eyes focused on the supply cart she'd been sorting. At 32, she discovered that staying quiet was often the smartest reaction to men like Bennett, men who viewed temporary surgeons as lesser, expendable, barely worth recognizing. You're just covering until we locate an actual replacement for Dr. Morrison, Bennett went on, fixing his pricey Rolex. Don't mess with my complicated cases. Stay with what you're qualified for. Emma's hands paused on the surgical tools she'd been arranging. Her movements had been systematic, efficient, the kind of exactness that spoke of muscle memory built over thousands of operations. But Bennett didn't see it. He saw scrubs and a temporary badge. Nothing more. The other residents observed from the nearby nurse's desk. Dr. Marcus Chen whispered something to his colleague, and they both grinned. The silent substitute who never discussed her history, who'd been at Sacred Heart for precisely 3 weeks, who seemed happy to blend into the institutional beige walls. What Bennett and the others didn't notice was the way Emma checked gear. The orderly method wasn't civilian standard. It was combat protocol, where one overlooked detail could cost lives when mortars were dropping, and the nearest backup was 40 meters through hostile ground. Sophie Rodriguez, a 28-year-old nurse with keen observation abilities, stopped while passing. She'd picked up on something about Dr. Hayes that others missed, the way she moved, the way she positioned herself with her back never completely to doorways. Small details that spoke of instruction most civilian medical personnel would never get. Dr. Hayes, Sophie said softly, the attending wants you in OR3 for a standard appendectomy in 20 minutes. Emma nodded, finally glancing up. Her hands bore the subtle traces of scars that most people wouldn't identify, small marks from stitching in, environments where gloves were sometimes a luxury, where you operated by headlamp, where the line between surgeon and soldier blurred into survival. 3:47 in the afternoon. The wall clock ticked consistently. A Tuesday in November. Boston's steel sky pressed against the medical center windows, and somewhere in the distance, ambulance sirens wailed their endless song. Emma moved toward the surgical prep area, passing photographs of distinguished Sacred Heart surgeons lining the hallway. Men mostly, their achievements displayed in gold-framed certificates. She wondered if any of them had ever conducted emergency thoracotomy in a field hospital while enemy fire stitched holes in the tent above them. In the changing area, Emma pulled her sandy blonde hair into a tight bun. Her reflection showed a woman who looked ordinary. Average height, fit but not commanding, the kind of person who vanished in crowds. Exactly what she'd wanted when she departed the army 8 months ago. But as she scrubbed for surgery, her hands moved in sequences that betrayed her. 3 tours in Iraq and Syria had taught her efficiency that civilian medicine rarely required. Every movement counted, every second mattered. Because in Aleppo, in Fallujah, in places whose names remained classified, hesitation meant watching soldiers die. Dr. Hayes, Dr. Chen appeared beside her at the scrub station. Bennett says you got your degree from Boston Medical. I tried looking you up in their alumni directory. Couldn't find you listed anywhere before last year. Emma kept scrubbing, counting the mandatory time in her head. Sometimes records get delayed in processing. Chen didn't look persuaded, but he didn't push further. The truth was buried in military files marked classified. Major Emma Hayes, MD, United States Army Medical Corps. 8 years of combat surgical experience. Decorated for bravery. Discharged not for incompetence, but for knowing too much about operations that officially never existed. The overhead speakers crackled. Trauma alert! Multiple casualties incoming. All available surgical staff to emergency department immediately. Emma's body reacted before her mind caught up. That particular alertness, the one that had kept her alive in Aleppo, surged through her system. She was moving toward the emergency department before Chen had finished processing the announcement. The emergency room erupted into controlled mayhem. Paramedics wheeled stretchers through automatic doors. Blood, shouting, the metallic smell that Emma associated with car crashes and IED explosions, and every other way human bodies could be torn apart. Multi-vehicle collision on the expressway. The charge nurse was coordinating assignments. We've got 8 casualties, 3 critical. Dr. Bennett takes Trauma Bay 1. Dr. Hayes, you're on Trauma Bay 3. Minor injuries. Emma moved to her assigned station, but her eyes tracked everything, the way she'd been trained to assess mass casualty events. Triage wasn't just about the patient in front of you. It was about understanding the entire battlefield, seeing patterns that others missed. That's when she saw him. Trauma Bay 1. The critical patient Bennett was rushing toward. The man on the stretcher was unconscious, covered in blood, but Emma's trained eye caught something that froze her mid-step, a mark on his neck, partially obscured by blood and road debris, but unmistakable to someone who'd seen it before. Cyrillic characters, faded, as if someone had attempted laser removal, but still visible under the harsh emergency room lights. Emma's breath caught. That mark. She'd seen it in Aleppo, 2019, on victims pulled from a bunker, children and teenagers trafficked and harvested for organs by an organization that operated in the shadows of war zones. The man on that stretcher shouldn't exist. The network had been dismantled, or so she'd been told when she left Syria. Dr. Hayes, Sophie appeared at her elbow. Your patient in Bay 3 is stable, just lacerations needing stitches. Emma forced herself to focus. The teenage girl with cuts from broken windshield glass, standard suturing. Her hands moved automatically, flawlessly, while her mind raced through implications. That mark meant the network wasn't dead. It meant someone she'd hoped never to see again was in Boston, in her medical center, bleeding out under Bennett's inexperienced hands, because the chief surgeon had never operated in conditions where you recognized trafficking victims by scars and marks and the specific pattern of old injuries. Your technique is incredible, the teenage patient said, watching Emma work. Doesn't even hurt. Years of practice, Emma replied, keeping her voice steady. But inside, every instinct screamed that something was wrong. That the man in Trauma Bay 1 wasn't just a car accident victim. That his presence in Boston, in her medical center, couldn't be coincidence. Sophie moved past, carrying supplies, but she paused. Dr. Hayes, are you okay? You look like you've seen something. I'm fine, Emma said, just focused. Overhead, Bennett's voice carried from Trauma Bay 1. I need more hands here. This bleeding won't stop. Someone page surgical backup. Emma looked at her completed work. The teenager was stable, but 20 feet away, a man with a mark she'd last seen in a Syrian war zone was dying. And if he died, so did any chance of finally destroying the organization that had haunted her for 6 years. She stood, remained motionless for exactly 3 seconds, while she made a decision that would unravel everything she'd built in Boston. The quiet life, the anonymity, the desperate attempt to forget the faces of victims she hadn't been able to save. But that mark passed too quickly through her field of vision. She needed to see that mark up close, needed to confirm what her training already told her was true. Because if that mark meant what she thought it meant, then her war wasn't over. It had just followed her home. The surgical residence lounge buzzed with whispered conversations when Emma entered to retrieve her belongings after finishing with the teenage patient. Dr. Marcus Chen and 2 other residents stopped talking the moment they noticed her presence. Did you see the temp handle those sutures? One of them muttered, just loud enough to be heard. Probably watched some YouTube tutorials last night. Chen smirked. Yeah, she's trying real hard to impress Bennett. Good luck with that strategy. Emma kept her expression neutral, grabbing her tablet from her locker. 3 weeks at Sacred Heart had taught her that responding to mockery only invited more attention. Better to remain unremarkable, forgettable, just another temporary surgeon filling a vacancy. But Sophie Rodriguez, who'd been restocking supplies in the corner, caught Emma's eye. The nurse's expression showed something different than the resident's dismissiveness. Recognition, perhaps, or suspicion that Dr. Hayes wasn't quite what she appeared to be. "Dr. Hayes," Bennett's voice echoed from the doorway. "The appendectomy in OR3 is yours. Patient is a 38-year-old male presenting with acute abdominal pain. Standard procedure. Try not to complicate it." The emphasis on try carried unmistakable condescension. Bennett didn't wait for acknowledgement before disappearing back into the hallway, his expensive leather shoes clicking against linoleum. 4:15 in the afternoon. 23 minutes since the multi-vehicle trauma patients had arrived. Emma made her way to OR3, her mind still processing the image of that mark on the critical patient's neck. But she had a job to complete first. Professional compartmentalization was another skill developed in war zones, where personal feelings had to wait until after the casualties were. Schafter stabilized. The patient, Daniel Martinez, lay prepped on the surgical table, his vitals displayed on monitors showing elevated heart rate and blood pressure consistent with acute pain. The anesthesiologist, Dr. Rachel Kim, nodded as Emma entered. "Ready when you are, Dr. Hayes?" Emma approached the table, her trained eyes immediately scanning beyond the obvious presenting symptoms. Martinez's abdomen showed classic signs of appendicitis, guarding, rigidity in the right lower quadrant. But something else caught her attention. The pattern of inflammation, the way his breathing changed with position, the subtle discoloration that most surgeons wouldn't notice without specific experience. "His pressure is dropping faster than expected for simple appendicitis," Emma said, checking the monitors again. "When did the pain start?" The surgical nurse consulted her chart. "Patient reported 6 hours ago. Came in 2 hours ago when it worsened." 6 hours was within the time frame for uncomplicated appendicitis, but Emma's instincts, honed through hundreds of combat surgical emergencies, signaled something more dangerous. The trajectory of deterioration suggested perforation, possibly with peritoneal contamination. "Dr. Kim, keep close watch on his BP." Emma's hands moved to begin the procedure, but her voice carried authority that surprised everyone in the OR. "This might not be as straightforward as the chart indicates." "What makes you say that?" Kim asked, genuinely curious, rather than challenging. "The presentation pattern. Rigidity is too widespread for isolated appendicitis. If I'm right, we'll find perforation with contamination requiring extensive washout." Emma made her initial incision with movements that were precise, economical, practiced. No hesitation, no unnecessary flourishes. Each cut served a specific purpose, executed with the kind of efficiency that came from operating in conditions where every second counted and resources were limited. The moment she exposed the surgical field, the distinct odour confirmed her diagnosis. "Perforated appendix with peritoneal contamination," Emma said. "Exactly what I predicted from external observation alone." "How did you know?" Kim stared at the contaminated tissue. "That's remarkable diagnostic intuition." Emma didn't answer immediately, focused on assessing the extent of contamination. In Kandahar and Aleppo, she'd seen this pattern dozens of times. Soldiers who'd ignored pain for hours during missions, presenting with advanced peritonitis. The smell, the tissue appearance, the specific progression became as recognizable as faces. "We need to extend the incision and prepare for complete washout." Emma's hands moved with practiced confidence. "Suction here. I need additional irrigation. This is going to take longer than scheduled." The surgical team adapted to her directions, responding to the calm authority in her voice. Kim noticed something that the residents in the lounge had missed. Dr. Hayes' technique wasn't textbook civilian medicine. It was faster, more direct, with modifications that prioritized efficiency without sacrificing precision. Sophie Rodriguez, who'd been called in to assist with additional supplies, watched through the OR observation window. She'd served 2 years as a medical technician in Afghanistan, working with army surgical teams. The way Dr. Hayes moved, the specific modifications to standard procedures, the systematic approach to contaminated tissue, all of it screamed military training. Those sutures, Sophie whispered to herself, military-style interrupted sutures, perfect spacing, independent redundancy, that's combat medicine technique. Inside the OR, Emma worked methodically through the contaminated tissue. Her hands performed the 3-point suturing technique designed for field conditions, where subsequent infections were high probability. Each suture was independent, so if one failed, the others maintained integrity, a technique rarely taught in civilian surgical programs. "Your suturing is unusual, Dr. Hayes," Kim observed. "Where did you learn that approach?" "Medical school covers various techniques," Emma replied, her focus never leaving the surgical field. "Some work better for specific conditions." It wasn't exactly a lie, but it wasn't the truth either. The real answer involved a field hospital outside Fallujah, where a special forces medic had taught her advanced combat surgical techniques during a quiet week when casualties were mercifully light. 53 minutes from initial incision to final closure. Martinez's vitals remained stable throughout, and the contaminated tissue had been thoroughly cleaned. Emma stepped back from the table, her work complete. "That was impressive, Dr. Hayes," Kim said, genuine respect in her voice. "You turned a potential disaster into a textbook save." "Just thorough assessment," Emma replied, already removing her surgical gloves. "Standard protocol when you pay attention to all the indicator," but it wasn't standard, and both Kim and Sophie knew it. In the scrub room afterward, Emma washed methodically, counting the required time. Through the window, she could see the hallway where Bennett was coordinating with other attendings about the trauma patients from the vehicle collision. The man with the mark, Victor Petrov, according to the name that had flashed briefly on the ER board, was still in surgery. Bennett's surgery, which meant if there were complications, the chief surgeon might miss critical details that someone with combat medical experience would recognize immediately. "Dr. Hayes," Sophie appeared beside her at the sink. "Can I ask you something?" Emma's guard went up immediately. "Of course. Those suturing techniques you used." Sophie's voice was quiet, careful. "I've seen them before. In Afghanistan, Army combat surgical teams used those exact modifications for contaminated field wounds." Emma kept washing, her expression neutral. "I study extensively. Medical journals, international techniques, military medical publications are publicly available." Sophie didn't look convinced. "I was a medical technician. Forward Operating Base Ghazni, 2021 to 2023. I worked with army surgeons who operated exactly like you do. Fast, efficient, focused on redundancy and field conditions." The two women's eyes met in the mirror above the sink. Emma saw recognition there, and something else. Not hostility, but the careful assessment of someone who understood what military medical service actually meant. "Sophie," Emma said quietly, "I need you to understand something. Whatever you think you know about my background, I came to Sacred Heart to practice medicine. Just medicine. Not to talk about where I served or what I've seen." "I'm not trying to expose you," Sophie replied. "I'm trying to understand. Because what you just did in that OR, that was combat-level triage and surgical response. And if you have that kind of experience, this medical centre needs to know. We need doctors who can handle truly difficult cases." Before Emma could respond, an alarm sounded overhead. "Code Blue, Trauma Bay 1, all available personnel to Trauma Bay 1 immediately. Victor Petrov." Emma's blood ran ice cold. The man with the mark. Something had gone wrong. She ran toward Trauma Bay 1, Sophie right behind her. Whatever careful anonymity she'd been maintaining, whatever quiet civilian life she'd been building, was about to shatter. Because the patient coding in that trauma bay wasn't just a car accident victim. He was a ghost from a mission she thought had ended 6 years ago in Syria, and his presence in Boston meant the war she'd tried to leave behind had followed her across continents and oceans. It meant her past was about to collide with her present in ways that would force her to choose between remaining hidden or stepping forward into the storm. And Emma Hayes, former major in the Army Medical Corps, had never been very good at staying hidden when lives were at stake. Trauma Bay, one looked like every mass casualty scene Emma had ever worked. Blood soaked through surgical drapes, monitors screamed their warnings, and Bennett's commands grew increasingly frantic as Viktor Petrov's blood pressure plummeted toward fatal levels. "Get me more blood," Bennett shouted, his usual arrogance replaced by barely controlled panic. "Why isn't the bleeding stopping?" Emma pushed through the gathered crowd of residents and nurses. 5:22 in the afternoon. 35 minutes since Victor had coded. Bennett had stabilized him temporarily, but whatever technique he'd used wasn't addressing the real problem. "Dr. Hayes, what are you doing here?" Bennett snapped without looking away from the patient. "This is a critical trauma, not something for temporary staff to observe." Emma's eyes locked onto Victor's exposed thoracic cavity. The pattern of trauma was immediately recognizable to someone with her background, not from vehicular impact, from surgical intervention gone wrong. "Dr. Bennett, that hemorrhaging isn't from the accident." Emma stepped closer, her voice carrying quiet authority. "Someone tried to remove his kidney. Recently, within the past 72 hours. The incision pattern..." The room went silent, except for monitor alarms. Bennett finally looked at her, his expression caught between irritation and confusion. "What are you talking about?" "The incision pattern." Emma pointed to Victor's flank where Bennett had been focusing his efforts. "That's not blunt force trauma. It's a surgical access point that wasn't properly closed. The hemorrhaging is coming from severed renal vessels." "How could you possibly diagnose that from observation?" Dr. Chen demanded from the doorway. "Because I've seen it before," Emma met Bennett's eyes. "In Syria, victims of organ trafficking. The technique is distinctive. Whoever operated on him wasn't trying to save his life. They were trying to harvest organs." Bennett's face paled. He looked back at Victor's, exposed tissue with new understanding. The pattern Emma described was there, obvious now that she'd pointed it out. The kind of detail that civilian trauma surgeons wouldn't recognize because they'd never worked in conditions where humans were commodities. "If you're right," Bennett said slowly, "then my approach has been completely wrong." He paused, and Emma saw the moment his pride became secondary to his patient's survival. "Can you assist?" Emma moved to the table without waiting for further permission. Her hands found sterile gloves, and she positioned herself across from Bennett. Sophie Rodriguez appeared at her shoulder with additional instruments, the nurse's military medical experience making her anticipate Emma's needs before she voiced them. "We need to control the renal vessel bleeding first." Emma's hands moved with practiced efficiency. "Clamp, small, Richardson retractor, suction here." Her movements were different now, no longer the measured caution of a temporary surgeon trying to remain unremarkable. These were the movements of someone who'd performed emergency surgery under impossible conditions, where hesitation meant death and protocols were suggestions rather than requirements. Dr. Chen watched from the observation window, his earlier mockery forgotten. "She's using military field techniques," he whispered to another resident. "That's not standard civilian approach." Inside the bay, Emma isolated the damaged renal vessels. The hemorrhaging was worse than Bennett had realized, masked by the patient's position and the assumptions about vehicular trauma. In a civilian context, Victor should have already bled out, but whoever had operated on him initially had applied temporary hemostatic measures designed to keep him alive just long enough to complete extraction. "This was professional work," Emma said, her voice clinical despite the implications. "Whoever did this has surgical training. They knew exactly where to cut, how to access the kidney, and how to keep the patient alive during transport." "Transport where?" Bennett asked, his hands following Emma's directions as she guided him through the repair. To a buyer. Emma applied military-era interrupted sutures, each one independent of the others. Organ trafficking networks don't just harvest. They have clients waiting. The surgery was interrupted, which is why he ended up in a car accident. Something went wrong with the transaction. How do you know all this? Sophie asked quietly, though her tone suggested she already knew the answer. Emma didn't respond immediately, focused on the delicate work of repairing vessels that Bennett's standard approach would have missed. 8 years of combat surgery had taught her to read trauma in ways civilian medicine didn't require. The specific angle of incisions, the type of suturing used, the pattern of tissue damage that indicated not just what happened, but who did it and why. The mark on his neck, Emma continued working. Under the surgical light, you'll see faded Cyrillic characters, Bratva, Russian mafia. They ran organ trafficking operations out of Syria during the conflict. I treated their victims in Aleppo. Bennett's hands paused for just a moment. You were in Syria? 3 tours, Iraq, Syria, classified locations. Emma's voice remained steady. Professional. 8 years as an army combat surgeon. Major Emma Hayes, Medical Corps. I saw this exact pattern 43 times. Lost 2 patients because we couldn't stabilize them fast enough in field conditions. The revelation hung in the air like smoke. Sophie Rodriguez's suspicions confirmed. Bennett's understanding of his temporary surgeon completely transformed. Chen and the other residents processing the fact that they'd been mocking someone with more trauma experience than their entire department combined. Why didn't you tell us? Bennett asked, his voice different now. Respectful. Because I wanted to practice medicine without people seeing me as broken or heroic or anything other than a surgeon. Emma sealed the final vessel repair. But that man on your table isn't a random accident victim. He's part of an organization I thought I'd left behind in Syria, and his presence in Boston means something very bad is happening. Victor's vitals began to stabilize. The hemorrhaging was controlled. Emma stepped back, letting Bennett complete the closure under her guidance. Her hands were steady, but her mind raced through implications. The Bratva network had supposedly been dismantled after a joint military Interpol operation in 2019. Emma had been part of that mission, treating victims recovered from underground facilities. The operation had been classified, buried under layers of secrecy that officially didn't exist. But if Victor was here, alive, with the mark still visible on his neck, then the network hadn't been destroyed. It had migrated, adapted, continued operating in new territories. Dr. Hayes, Sophie spoke quietly. When you saw him in the ER, you recognized something. That's why you've been watching this bay. Emma nodded slowly. I saw the mark. I needed to be sure before saying anything, because if I'm right, Victor isn't a victim. He's an operator. He's the one who does the cutting. Bennett looked up sharply. Are you saying I just saved the life of an organ trafficker? You saved the life of a patient, Emma replied. But yes, and now we need to understand why someone tried to kill him, and why he ended up in Boston. Before anyone could respond, hospital security appeared at the bay entrance. A man in a suit followed them, his bearing and expression immediately identifying him as federal law enforcement even before he showed identification. I'm Detective Nathan Cross, Federal Crimes Task Force. The man's voice carried calm authority. I need to speak with whoever performed surgery on Viktor Petrov. Bennett and Emma exchanged glances. That would be both of us, Bennett said. I'm Dr. Richard Bennett, Chief of Surgery. Cross's eyes moved to Emma, and she saw recognition there, the kind that came from reading classified files. And you're Dr. Hayes, or should I say, Major Hayes? Emma felt the last walls of her civilian anonymity crumbling. Just Dr. Hayes. I left the army 8 months ago. Cross stepped closer, his voice lowering. Viktor Petrov is on Interpol's watch list, former surgeon. suspected involvement in organ trafficking operations across 3 continents. The car accident was actually an attempted assassination by rival elements within the Bratva. His presence in Boston suggests he was setting up new operations here. Emma's blood ran cold. New operations meant new victims, new harvesting facilities, new clients willing to pay premium prices for organs taken from unwilling donors. "Detective," Emma said carefully, "I treated victims of this network in Syria, children, teenagers, all with the same mark on their necks that Petrov has. If he's establishing operations in Boston, we need to stop him before he finds new victims." Cross nodded. "Which is why I need your help, Major. You're one of the few people who can identify Bratva surgical patterns. We need Petrov alive to testify, but we also need someone who understands how these networks operate." "I'm not Major anymore," Emma insisted. "You're a civilian surgeon who just saved the life of a man everyone else had written off," Cross countered, using techniques that don't exist in civilian medical textbooks. "Whether you want to acknowledge it or not, Dr. Hayes, you're still the best combat trauma surgeon the Army ever produced." Bennett watched this exchange with growing understanding, the pieces fitting together. Why Emma's techniques were so advanced, why she could diagnose conditions others missed, why she'd been content to remain anonymous in a temporary position. "Dr. Hayes," Bennett said quietly, "if what you're saying is true, if this man is part of an organization that traffics organs, then this medical center might be at risk. We need your expertise, not as a favor, but because you're the only one here who truly understands what we're dealing with." Emma looked at Victor, still unconscious on the table, still alive because of techniques she'd learned in war zones. The mark on his neck was barely visible under surgical drapes, but she knew it was there, knew what it represented, knew that her war hadn't ended in Syria. It had just followed her home. "Detective Cross," Emma said finally, "what do you need me to do?" "Keep him alive," Cross replied, "and help me understand how deep this network goes, because Viktor Petrov didn't come to Boston alone, and whatever he was planning, someone was willing to kill him to stop it, which means there are competing interests, multiple players, and this medical center is now at the center of something that could turn very dangerous very quickly." The trauma bay doors swung open. A nurse appeared, her expression urgent. "Dr. Bennett, we have another situation. There's a man at reception asking about Viktor Petrov. Says he's family, but security noticed he has Cyrillic tattoos and is asking very specific questions about which room the patient is in." Cross's hand moved instinctively toward his concealed weapon. "That's not family, that's cleanup crew. They know he survived, and they're coming to finish what the car accident started." Emma felt familiar adrenaline surge through her system, the same feeling she'd experienced before combat operations, before missions that required split-second decisions and absolute confidence in her training. Her civilian life in Boston had lasted exactly 3 weeks. Now, standing in a trauma bay with a federal detective, a Russian organ trafficker on the table, and hostile elements already inside the medical center, Major Emma Hayes realized something crucial. She'd never really left the war at all. She'd just been waiting for it to find her again. And this time, the battlefield was her own hospital, her own city, with civilians at risk and nowhere to run, even if she wanted to. The question was no longer whether she'd step forward. It was whether she could step forward fast enough to stop what was coming. Detective Cross moved with practiced efficiency, coordinating with hospital security through his radio while maintaining visual contact with the man at reception. Emma watched from the trauma bay doorway, her military training automatically assessing tactical positions and potential threat vectors. "We need to move Victor to ICU immediately," Cross said, his voice low but urgent. "Secure floor, limited access points. Right now, he's too exposed." "He's not stable enough for transport," Bennett protested, looking at the monitors. "Moving him could restart the hemorrhaging. Then he dies here when that man at reception gets past security." Cross's tone left no room for argument. "Your choice, doctor. Risk surgical complications or guarantee he won't survive the next 30 minutes. 6:37 in the evening. The shift change would happen in 23 minutes, which meant corridors would be crowded with staff rotating positions. Perfect cover for someone trying to reach a patient without being noticed. Emma made a decision that surprised everyone, including herself. We take him to ICU, but I go with him. If complications arise during transport, I can manage them in transit better than waiting for another surgical team to respond to a code. Dr. Hayes, you're not assigned to ICU, Bennett said, though his tone lacked its earlier condescension. And Victor is technically still my patient since I completed the repair work that's keeping him alive. Emma met his eyes. Unless you want to explain to Detective Cross why you let a federal witness die because of hospital bureaucracy. Bennett's jaw tightened, but he nodded. Fine, but Sophie Rodriguez goes with you. She's ICU certified and knows the floor layout. The transfer happened quickly. Victor remained sedated, his vitals holding steady but fragile. Emma positioned herself at the head of the stretcher, one hand monitoring his airway, the other ready to apply pressure if internal bleeding resumed. Sophie controlled the IV lines, her movements showing the same military medical efficiency that had first made her suspicious of Emma's background. They moved through corridors that were beginning to fill with evening shift staff. Emma's eyes tracked every person they passed, looking for the behavioural markers she'd learned to recognise in combat zones: hands in wrong positions, eyes that followed too intently, body language that signalled hostile intent hidden behind civilian clothing. Dr. Hayes, Sophie said quietly as they waited for an elevator. That man at reception, the one Detective Cross is watching. I saw his tattoos when he gestured. Vor Vizakone, thief-in-law. That's Russian mafia hierarchy. Emma's estimation of Sophie Rodriguez went up another notch. Most nurses wouldn't recognise Bratva rank markings, but military medical personnel who'd served in Eastern European conflict zones learned to identify them quickly. Knowing who was connected to organised crime could mean the difference between treating a patient and walking into an ambush. How many tours did you serve? Emma asked. 2 years. Afghanistan, Sophie replied. Fob, Ghazni and Bagram. Saw enough trauma patterns to last a lifetime. When I got out, I thought civilian nursing would be quieter. The elevator doors opened. They moved Victor inside, and Emma watched the floor numbers climb. Nothing's ever as quiet as it seems, Emma said. Wars don't end. They just change locations. Is that why you're here? Sophie asked. Running from one that followed you? Before Emma could answer, alarms sounded from Victor's monitors. His blood pressure was spiking dangerously, heart rate climbing toward arrhythmia. But he was still sedated, still unconscious. The physiological response didn't match his medical condition. Emma's training kicked in immediately. She checked his pupils, assessed his breathing pattern, looked for signs of awakening or adverse reaction to medications. Nothing matched the monitor readings. Sophie, check the IV lines. Emma's voice carried sudden urgency. Something's wrong with his vitals, but it's not consistent with his surgical recovery. Sophie examined the lines, and her face went pale. Dr. Hayes, this saline bag, it's not from our pharmacy. The labelling is different, and it's nearly empty. Emma's blood ran cold. She clamped the IV line immediately, disconnecting it from Victor's access point. The fluid in the bag looked clear, appeared normal, but if it wasn't hospital issue, then someone had replaced it. Someone who knew exactly which medications would cause cardiac distress without leaving obvious traces. Get me a sample kit now, Emma ordered. We need this analysed immediately. And call Cross. Someone already got past security. They're not trying to kill Victor with violence. They're trying to make it look like surgical complications. The elevator reached the ICU floor. Sophie was already on her radio, calling for backup and lab analysis. Emma kept pressure on Victor's access points, monitoring his vitals manually rather than trusting the monitors that could have been compromised. The ICU floor was quieter than the main hospital, but that only made Emma more alert. In combat zones, quiet meant either safety or ambush, and she'd learned never to assume it was safety until proven otherwise. "Room 7, the charge nurse directed them. "It's isolated, easier to secure." They moved Victor into the room, and Emma began the delicate process of stabilizing him, while simultaneously checking every piece of equipment for tampering. Sophie worked beside her, their coordination seamless, despite having worked together for less than an hour. Cross arrived with 3 hospital security officers. His expression was grim. The man at reception disappeared during the elevator transfer. Security footage shows he made a call, then left through the emergency exit. "We're dealing with a coordinated team, not a lone operator." "The IV bag," Emma said, not looking away from her patient. "Someone replaced it with something that would have caused cardiac arrest. Made it look like surgical complications rather than assassination." Cross examined the bag Emma had isolated. "Professional work, probably had inside help. Someone on staff who could access pharmaceuticals and move through the medical centre without raising suspicion." Bennett entered the room, his usual confidence replaced by visible concern. "Dr. Hayes, hospital administration wants to know what's happening. We have a potential security breach, federal investigators in the ICU, and staff asking questions about why a temporary surgeon is running point on a critical patient." Emma finally looked up from Victor, her blue-grey eyes carrying the intensity of someone who'd made life-and-death decisions under impossible conditions. "Tell administration that their medical centre is being used as a battlefield by an international organ trafficking network. Tell them that Victor Petrov isn't just a patient. He's the key to dismantling an organisation that's been operating for decades. And tell them that if they want him alive to testify, they need to let me do my job without bureaucratic interference." The room fell silent. Bennett processed Emma's words, seeing her fully for perhaps the first time. Not as a temporary replacement, not as a quiet surgeon who'd been content to remain in the background, but as exactly what she was: a combat veteran who'd operated in conditions where hospitals were targets, where patients were assets, and where hesitation meant death. "How many times have you done this?" Bennett asked quietly. "Protected a patient from active threats, while simultaneously keeping them alive?" Emma thought about Aleppo, about the field hospital that had been hit by mortars while she was in the middle of surgery, about the 3 hours she'd spent operating by flashlight while gunfire echoed outside, knowing that enemy forces were specifically targeting medical facilities. "More times than I can count," Emma replied. "And I'm still here, which means I know how to survive situations that shouldn't be survivable." Victor's eyes suddenly flickered open, not the gradual awakening of someone coming out of sedation, but the sharp awareness of someone who'd been conscious and listening. His gaze found Emma immediately, and she saw recognition there, the kind that came from shared experiences in dark places. He spoke in Russian, his voice weak but clear. "You were in Aleppo, the field hospital, 2019. Emma felt time compress. 6 years vanished in an instant, replaced by memories of a bunker converted into a surgical facility, of victims with the same mark Victor carried, of promises she'd made to dying children that their suffering would be avenged. "Yes," Emma replied in fluent Russian, her voice steady despite the rush of memories. "I was there. I treated the people your organisation trafficked." Victor's expression showed something unexpected, not defiance or hatred, but something that looked almost like relief. "Then, you know what they're capable of, what they'll do to keep me from talking." Emma switched back to English, aware that Cross, Bennett and Sophie needed to hear this conversation. "Victor, you're going to tell us everything. Every name, every location, every operation. Because the alternative is dying in this hospital room while your former colleagues make sure you never testify." "They're already here," Victor said, his eyes moving to the door. "Not just the one you saw at reception. There are 2 others, one posing as pharmacy technician, one as security. They rotate positions every 12 hours, waiting for the right moment." Cross was already on his radio, coordinating with hospital security to identify anyone who'd started working in the, trying to make it look like surgical complications. The elevator reached the ICU floor. Sophie was already on her radio, calling for backup and lab analysis. Emma kept pressure on Victor's access points, monitoring his vitals manually rather than trusting the monitors that could have been compromised. The ICU floor was quieter than the main hospital, but that only made Emma more alert. In combat zones, quiet meant either safety or ambush, and she'd learned never to assume it was safety until proven otherwise. Room 7, the charge nurse directed them. It's isolated, easier to secure. They moved Victor into the room, and Emma began the delicate process of stabilizing him, while simultaneously checking every piece of equipment for tampering. Sophie worked beside her, their coordination seamless, despite having worked together for less than an hour. Cross arrived with 3 hospital security officers. His expression was grim. The man at reception disappeared during the elevator transfer. Security footage shows he made a call, then left through the emergency exit. We're dealing with a coordinated team, not a lone operator. The IV bag, Emma said, not looking away from her patient. Someone replaced it with something that would have caused cardiac arrest, made it look like surgical complications rather than assassination. Cross examined the bag Emma had isolated. Professional work, probably had inside help. Someone on staff who could access pharmaceuticals and move through the medical centre without raising suspicion. Bennett entered the room, his usual confidence replaced by visible concern. Dr. Hayes, hospital administration wants to know what's happening. We have a potential security breach, federal investigators in the ICU, and staff asking questions about why a temporary surgeon is running point on a critical patient. Emma finally looked up from Victor, her blue-grey eyes carrying the intensity of someone who'd made life-and-death decisions under impossible conditions. Tell administration that their medical centre is being used as a battlefield by an international organ trafficking network. Tell them that Victor Petrov isn't just a patient. He's the key to dismantling an organisation that's been operating for decades. And tell them that if they want him alive to testify, they need to let me do my job without bureaucratic interference. The room fell silent. Bennett processed Emma's words, seeing her fully for perhaps the first time. Not as a temporary replacement, not as a quiet surgeon who'd been content to remain in the background, but as exactly what she was, a combat veteran who'd operated in conditions where hospitals were targets, where patients were assets, and where hesitation meant death. "How many times have you done this?" Bennett asked quietly. "Protected a patient from active threats while simultaneously keeping them alive?" Emma thought about Aleppo, about the field hospital that had been hit by mortars while she was in the middle of surgery, about the 3 hours she'd spent operating by flashlight while gunfire echoed outside, knowing that enemy forces were specifically targeting medical facilities. "More times than I can count," Emma replied. "And I'm still here, which means I know how to survive situations that shouldn't be survivable." Victor's eyes suddenly flickered open, not the gradual awakening of someone coming out of sedation, but the sharp awareness of someone who'd been conscious and listening. His gaze found Emma immediately, and she saw recognition there, the kind that came from shared experiences in dark places. He spoke in Russian, his voice weak but clear. "You were in Aleppo, the field hospital, 2019. Emma felt time compress. 6 years vanished in an instant, replaced by memories of a bunker converted into a surgical facility, of victims with the same mark Victor carried, of promises she'd made to dying children that their suffering would be avenged. "Yes," Emma replied in fluent Russian, her voice steady despite the rush of memories. "I was there. I treated the people your organisation trafficked." Victor's expression showed something unexpected, not defiance or hatred, but something that looked almost like relief. "Then, you know what they're capable of, what they'll do to keep me from talking." Emma switched back to English, aware that Cross, Bennett and Sophie needed to hear this conversation. "Victor, you're going to tell us everything, every name, every location, every operation. Because the alternative is dying in this hospital room while your former colleagues make sure you never testify. They're already here, Victor said, his eyes moving to the door. Not just the one you saw at reception. There are 2 others, one posing as pharmacy technician, one as security. They rotate positions every 12 hours, waiting for the right moment. Cross was already on his radio, coordinating with hospital security to identify anyone who'd started working in the past 48 hours. Sophie moved to check the room's access points, her military training evident in how she assessed tactical vulnerabilities. Victor looked back at Emma. In Aleppo, you made a promise to the girl with the mark on her neck. You told her that someone would stop us, that someone would make sure no more children were taken. Emma remembered. The teenager, 15 years old, dying from complications after a botched kidney removal. She'd held the girl's hand during her final minutes, promising justice that she hadn't been sure she could deliver. I remember, Emma said quietly. Her name was Nadia. Victor's eyes closed briefly. I was there. I saw you with her. And I knew then that someone like you, someone who cared that much, would eventually destroy everything we'd built. He paused, gathering strength. That's why I came to Boston. Not to set up new operations, to get away from them, to testify, to finally end what I helped create. The room processed this revelation. Viktor Petrov wasn't an operator establishing new trafficking networks. He was a defector trying to escape an organization that had decided he knew too much. He's not the threat, Emma met Cross's eyes. He's the target, which means everyone who's been trying to kill him, they're trying to protect operations that are already established here in Boston. Cross's expression hardened, which means we're not investigating a network being built. We're investigating one that's already active, already harvesting organs, already has victims lined up, and Victor is the only person who can tell us where. Victor's monitors began stabilizing as the effects of the contaminated IV faded from his system. But Emma knew the real danger was just beginning. Because if the Bratva had operatives inside the medical center, if they were willing to kill Victor despite federal protection, then the organization was bigger and more desperate than anyone had realized. Dr. Hayes, Bennett stepped closer. What do you need? Emma looked at Victor, at the man who carried 6 years of her unfinished business in the mark on his neck, at the ghost from Aleppo who'd somehow ended up in her operating room in Boston. Time, Emma said. 24 hours to keep him alive while Cross gets federal protection in place. And answers, every detail about who's running the Boston operations, where they're keeping victims, and how we stop them before anyone else ends up like Nadia. Victor nodded weakly. I'll tell you everything. But you need to understand something. The people I worked for, they don't forgive. They don't forget. And they're already inside your medical center, watching, waiting for the right moment to finish what they started. Then we make sure that moment never comes, Emma replied, her voice carrying the steel of someone who'd faced impossible odds and refused to surrender. Because I made a promise to a dying girl 6 years ago, and I don't break my promises. The war Emma thought she'd left in Syria had followed her home, but this time she wasn't running. This time she was finally going to finish it. 7:15 in the evening, 90 minutes since Victor had been stabilized in the ICU. Emma sat in the conference room adjacent to his secure room, facing Detective Cross, Bennett, Sophie Rodriguez, and Hospital Administrator Patricia Morrison. Their overhead lights cast harsh shadows across the table, covered with classified documents that Cross had finally been authorized to share. Major Emma Hayes, Cross said, opening a folder marked with federal classification stamps. 8 years Army Medical Corps, 3 tours in Iraq and Syria. Decorated for bravery after treating 43 victims recovered from a Bratva organ trafficking bunker in Aleppo, 2019. Morrison's expression shifted from bureaucratic concern to genuine alarm. Dr. Hayes, your application listed you as recently graduated from Boston Medical. Nothing about military service or combat experience. Because I wanted to practice medicine without people making assumptions, Emma replied, her voice steady. Without being seen as broken or dangerous or anything other than a surgeon. Bennett leaned forward. The techniques you use today, the diagnostic ability, the way you handled a hostile situation while keeping a critical patient alive, that's not civilian training. That's combat medical leadership, which is exactly why I didn't disclose it. Emma met his eyes. In civilian hospitals, veterans are either treated like heroes who can't function normally or like damaged goods who will crack under pressure. I wanted to be judged on my work, not my service record. Sophie spoke up, her voice carrying the understanding of someone who'd walked a similar path. I get it. When I came back from Afghanistan, every hospital interview asked about PTSD before they asked about my nursing skills. Like military service was a liability instead of an asset. Cross pulled out photographs, spreading them across the table. These are the victims we recovered in Aleppo. 43 individuals, ages ranging from 12 to 37, all showing evidence of organ removal, all marked with the same Cyrillic tattoo that Viktor Petrov has on his neck. Emma's hands tightened on the table edge. She remembered every face, particularly Nadia, the 15-year-old who died in her arms despite everything Emma had tried. Viktor was the primary surgeon for that operation, Cross continued, former trauma specialist from Moscow, recruited by the Bratva because of his surgical skill and willingness to work outside legal constraints. He performed the extractions personally. Then, why is he here? Morrison demanded. Why would he come to Boston if he's wanted internationally? Because he defected, Emma said quietly. The Bratva doesn't forgive defectors. They eliminate them, and everyone who helped them. Victor's debrief confirms that. Cross activated a laptop showing transcripts. He claims he wants to testify about the entire network. Names, locations, trafficking routes, client lists, everything. What made him change sides? Bennett asked. Organizations like that? Emma thought about the bunker in Aleppo, about the children lined up for harvesting like livestock, about the cold efficiency of a system that treated human beings as commodity parts. Conscience, Emma said, or fear. Or maybe he finally saw himself in those victims and couldn't live with it anymore. Cross pulled up a new document. According to Victor, the Boston operation has been active for 18 months. They've already harvested organs from at least 12 victims, all missing persons cases that were never connected because the bodies were disposed of completely. 12 people, Sophie's voice shook slightly, murdered for their organs right here in Boston. And Victor knows where the extraction facility is, Cross added. He knows who's running it, who the clients are, and how they transport victims without detection. But he refuses to provide details until he has guaranteed federal protection. Bennett stood, pacing to the window. This medical centre is now at the centre of a federal investigation into international organ trafficking. We have hostile operatives inside our facility, a witness who's barely stable, and no guarantee that keeping him alive won't put our entire staff at risk. Which is why we need Major Hayes, Cross said, using Emma's military rank deliberately. She's the only person here with experience, protecting witnesses in hostile environments while simultaneously providing medical care. I'm not Major anymore, Emma said firmly. That life ended when I left the army. Did it? Cross met her eyes. Because from where I'm sitting, you've spent the last 6 hours operating exactly like a combat surgeon, making tactical decisions, assessing threats, protecting a witness while keeping him alive. That's not civilian medicine, Major. That's military operations in a hospital setting. Emma felt the walls closing in. The civilian identity she'd tried to build was crumbling with every revelation. 3 weeks of anonymity destroyed in a single afternoon because a ghost from Aleppo had ended up on her surgical table. Sophie leaned across the table. Dr. Hayes, when I served in Afghanistan, we had a saying, you can leave the war, but the war doesn't leave you. Maybe it followed you here for a reason. To finish what I started in Aleppo, Emma said quietly. To finally stop the people who did this. Cross pulled up forensic analysis on his laptop. The contaminated IV bag we recovered from Victor's transport. Lab results show it contained a cardiac-triggering agent designed to cause arrhythmia indistinguishable from surgical complications. Professional work, medical knowledge required. Someone on our staff, Morrison's face went pale. We have a Bratva operative with pharmaceutical access and medical training working in this medical centre. Cross nodded. 2 operatives, actually. Victor identified them during his debrief. One is pharmacy technician Dmitry Sokolov, hired 6 days ago with forged credentials. The other is security officer Andrei Volkov, hired 10 days ago. Same method. Do we have visuals on them? Bennett asked, cross-displayed identification photos. Both men looked unremarkable. Mid-30s, professional appearance, the kind of people who disappeared into institutional backgrounds without drawing attention. Emma studied the faces, committing them to memory. In combat zones, knowing your enemy's face could mean the difference between survival and ambush. Victor also provided this. Cross opened another file and Emma's blood ran cold. It was a list. 12 names. 8 had lines struck through them. These are physicians who treated Bratva victims. Cross's voice was grim. 8 are confirmed dead, all within the past 3 years, all ruled as accidents or natural causes. Emma found her own name. Number 9. Unmarked. They're systematic. Eliminating witnesses, Sophie breathed. Anyone who could identify their surgical techniques or trafficking patterns. Emma's name was followed by 3 others. Dr. Lisa Park, who'd worked with Doctors Without Borders in Syria. Dr. Anthony Reyes, who'd testified in a European trafficking case. Dr. Jennifer Walsh, who'd published research on identifying illegal organ removal. They're not just killing witnesses, Emma said. They're harvesting their organs. Doctors have detailed medical records, blood types, tissue compatibility, health status. They're perfect targets. They turned doctors who fight trafficking into commodities for their clients. Bennett's face showed horror. Cross pulled up another document. We found Victor's blood work from his initial admission. Lab ran comprehensive analysis, including genetic markers. He displayed the results, and Emma understood immediately. Victor has rare tissue compatibility markers, Sophie said. He matches as a potential donor for 7 of the 12 doctors on that list. They were going to use him, Emma's voice was flat, not just silence him, but harvest his organs for the same doctors he'd victimized. Poetic justice from the Bratva's perspective, Cross agreed, but it also shows how sophisticated their tracking is. They maintain detailed medical records on targets, monitor compatibility, and plan harvesting operations years in advance. Emma stood, moving to the window where Bennett had been standing. Below, the hospital parking lot showed evening shift changes. Any of those people could be Bratva operatives. Any could be watching, waiting, reporting back to whoever ran the Boston operations. How much time until federal marshals arrive? Emma asked. Cross checked his watch. 10 hours. They're coordinating with Interpol because Victor's testimony covers operations in 6 countries. 10 hours. Emma processed the timeline. With 2 hostile operatives inside the medical centre, unknown number of external support, and Victor's knowledge making him a high-value target. We need to move him, Bennett said. Transfer to a federal facility where security is guaranteed. He won't survive transport, Emma replied. The surgical repairs are too fresh. Any movement could restart internal hemorrhaging. We keep him here. We control the environment. We maintain medical oversight. Which means defending this medical centre against an organisation that's operated for decades without being stopped, Morrison said. I need to consider evacuating non-critical patients, locking down the building, calling in additional security. Do that and you signal panic, Emma countered. The Bratva operatives will know we're onto them. Better to maintain normal operations while quietly securing Victor's floor. You're suggesting we turn this medical centre into a battlefield? Morrison stared at her. put our staff and patients at risk to protect a federal witness. I'm suggesting we do what's necessary to stop an organization that's murdered 12 people in Boston alone. Emma's voice carried steel. Nadia was 15 when she died. She made me promise to stop the people who did this. Victor is our only chance to keep that promise. The room fell silent. Cross studied Emma with new understanding. This isn't just about protecting a witness for you. This is personal. Every patient is personal, Emma replied. But yes, I held that girl's hand while she died. I told her someone would make sure no more children were taken. And then I left Syria thinking the problem was solved. She turned back to the window. Now I know it wasn't solved. It just moved, and I'm not leaving Boston until it's finished. Bennett approached her. Dr. Hayes, what do you need? Emma's military training provided the answer immediately. Secure Victor's floor, limited access, checked credentials, armed security at elevator and stairwell access points. Sophie stays on as his primary nurse because she has military medical experience and can recognize Bratva operational patterns. I maintain surgical oversight in case complications arise. And the two operatives cross-identified? Bennett asked. We leave them in place, Emma said, but we monitor them. Let them think they're still hidden while we prepare for their next move. You're using Victor as bait, Cross said, not disagreeing, but acknowledging the tactical reality. I'm using the only advantage we have, Emma replied. They think he's vulnerable. They think we don't know about their operatives. We let them maintain that assumption while building actual defences. Morrison processed this. You're asking me to authorise military-style defensive operations in a civilian medical centre. I'm asking you to protect your patients and staff from an active threat. Emma met her eyes. The Bratva has already demonstrated they'll operate inside this building. The only question is whether we respond reactively or proactively. Cross closed his laptop. Major Hayes is right. We have a narrow window to secure the witness and gather intelligence. If we wait for perfect solutions, Victor dies and the operation continues. Bennett nodded slowly. Dr. Hayes, you have my full support. Whatever resources you need, whatever protocols need adjusting, consider it done. Sophie stood. I'll coordinate with ICU staff, make sure everyone on Victor's floor understands the situation without causing panic. As the meeting dispersed, Cross pulled Emma aside. Major, one more thing. Victor's debriefing revealed something disturbing. The Boston operation isn't just harvesting organs. They're developing a genetic database, tracking potential donors by DNA markers, creating a registry of compatible targets. Emma felt cold understanding settle over her. They're not just reacting to demand, they're predicting it, creating supply before clients even ask. Which means, somewhere in Boston, there's a facility with a database containing genetic information on hundreds, maybe thousands of potential victims. Cross's expression was grim. And Victor knows where it is. Then we keep him alive, Emma said simply, whatever it takes. As she returned to Victor's room, Emma realised the war she'd tried to leave in Syria had indeed followed her to Boston. But this time she wasn't running. This time she had resources, support, and most importantly, the element of surprise. The Bratva thought she was just a temporary surgeon. They were about to discover that Major Emma Hayes had spent 8 years learning how to fight wars in places where rules didn't apply and survival required absolute commitment, and she'd never lost a patient she was determined to save. 9:47 in the evening. Victor's monitors showed stable vital signs, but Emma knew stability was temporary. Somewhere in the medical centre, 2 Bratva operatives were planning their next move. The question wasn't if they'd strike, but when. Emma sat beside Victor's bed, reviewing his medical charts while maintaining tactical awareness of every sound in the corridor. Sophie Rodriguez worked quietly at the monitoring station, her military medical background making her equally alert to threats that went beyond patient vitals. Dr. Hayes, Victor's voice was weak but clear. The extraction facility is in Seaport District, abandoned warehouse converted to look like private medical clinic. Container 478. Emma leaned closer. How many victims are there now? Victor's eyes showed something that might have been remorse. 3. Waiting for compatible buyers. If I don't report in by midnight, they'll assume I'm compromised and dispose of the evidence. Dispose meaning kill them. Emma's voice was flat. 3 people who will die if we don't move fast. Victor nodded weakly. The operation is run by Alexei Morozov, former Soviet military surgeon. He recruited me in Moscow, brought me into the network. He's here in Boston, overseeing everything. Detective Cross, who'd been standing guard outside, entered at hearing Morozov's name. Alexei Morozov is on Interpol's most wanted list. We've been tracking him for 8 years. You're telling me he's in Boston? Since 18 months, Victor coughed, wincing from surgical pain. He chose Boston because of the medical community. Easy to find buyers who won't ask questions. Rich clients who pay premium for quick transplants. Before Cross could respond, alarms sounded. Not medical monitors, but the fire alarm system. Loud, disorienting, designed to evacuate buildings. That's not a real fire. Emma was on her feet immediately. That's tactical distraction. They're creating chaos to mask an infiltration attempt. Cross was already on his radio. All units, this is not a drill. Lock down Viktor Petrov's floor. Nobody in or out without visual verification of credentials. The overhead sprinkler system activated. Water began pouring from ceiling fixtures, soaking equipment and creating additional confusion. Through the window, Emma could see hospital staff evacuating into hallways, following fire protocols that made tactical defense nearly impossible. They're good, Sophie said, securing Victor's IV lines against water damage, using our own safety procedures against us. Bennett burst through the door, soaked from corridor sprinklers. The fire department is on their way, but security reports the alarm was triggered manually from a pharmaceutical storage room, same room where Dmitry Sokolov works. Emma's tactical assessment shifted immediately. Sokolov triggered the alarm. That means his partner, the security officer, is making the actual move against Victor right now, while everyone's distracted. Cross pulled his weapon. Sophie, get Victor ready for immediate transport if necessary. Emma, Bennett, with me. We secure the access points. But Victor's monitors suddenly flatlined, all of them simultaneously. Not gradual decline, but instant cessation of all the vital sign readings. Emma spun back to the bed, her hands immediately finding Victor's carotid artery. He's alive. His pulse is strong. Emma's eyes tracked to the monitoring equipment. Someone cut the power to his monitors remotely. They're making it look like he coded so medical staff will flood this room. The code blue alarm sounded, automated system responding to the flatlined monitors, calling every available medical professional to Victor's room. Exactly what the Bratva wanted. Maximum confusion. Maximum access. Cancel that code, Emma shouted toward the hallway. Patient is stable. Repeat, cancel code blue. This is a false alarm. But hospital protocols were already in motion. Residents and nurses were running toward Victor's room, creating exactly the chaos that would allow an operative to slip through security checkpoints, unnoticed. Cross positioned himself at the door. Nobody enters this room without showing ID and explaining their presence. I don't care what your badge says. Through the window, Emma saw hospital security officer Andrei Volkov moving through the crowd of medical staff. He wore the right uniform, carried the right credentials, and moved with the confidence of someone who belonged. But Emma had studied his photo. She knew his face. Sophie, lock the door. Now. Sophie hit the security lock just as Volkov reached for the handle. He didn't try to force entry, didn't draw a weapon. Instead, he smiled through the window and walked away, disappearing into the crowd of evacuating staff. He was testing our response, Cross said, seeing if we knew about him. Now he knows we do, which means Plan B, Emma said. If they can't get to Victor directly, they'll force us to move him. create a situation where transport becomes mandatory and ambush us en route. As if confirming her prediction, a nurse appeared at the window, shouting over the alarm noise. Dr. Hayes, we have a mass casualty event in the ER, bus accident on the expressway. All surgeons needed immediately. Emma didn't move. How convenient. Mass casualty exactly when we're defending a witness. That's not coincidence. The nurse looked confused. Dr. Hayes, there are actual victims bleeding in our ER. Are you refusing to help? Bennett stepped forward. I'll coordinate the trauma response. Hayes stays with our witness. This is beyond normal medical protocols. The medical centre's overhead speakers crackled. All personnel evacuate to designated assembly points. This is not a drill. Repeat, evacuate immediately. They're escalating, Sophie said. If we don't evacuate Victor, we're violating hospital safety protocols. If we do evacuate him, we expose him to ambush. Emma's mind raced through tactical options, drawing on 8 years of combat medicine, where every decision carried life or death consequences. We don't evacuate. We turn this room into a defensible position and wait for federal marshals. Cross checked his watch. Marshals are still 4 hours out. Can we hold that long against a determined assault? We held positions in Fallujah against worse odds, Emma replied. This is just another battlefield, with better equipment. Bennett stared at her. Dr. Hayes, you're talking about defending a hospital room like it's a military strongpoint. We have policies, regulations, civilian safety to consider. And Victor has 3 victims waiting to be murdered if we don't keep him alive to testify. Emma met his eyes. Sometimes civilian policies don't apply to combat situations. This is combat, Dr. Bennett. It just happens to be happening in your medical centre. The fire alarm suddenly cut off. The sprinklers stopped. The corridor fell into eerie silence, broken only by distant sirens and radio chatter. That's the calm before the storm, Cross said quietly. They're regrouping, planning the real assault. Sophie checked Victor's actual vitals manually. He's stable, but deteriorating. The stress is affecting his surgical recovery. If we don't resolve this soon, complications could kill him before the Bratva does. Victor spoke weakly. There's something else you need to know. The 3 victims at the warehouse. One of them is a doctor, Dr. Jennifer Walsh. She was on the target list. They took her 3 days ago. Emma's blood ran ice cold. Jennifer Walsh was number 12 on the list, the last living doctor who treated Bratva victims. If she died, Victor would be the only surviving witness, with direct knowledge of the entire network. They're not just eliminating witnesses, Emma said. They're systematically removing anyone who could expose them. Walsh's death would close the last loose end, except Victor. Which makes tonight their deadline, Cross understood immediately. After midnight, they dispose of evidence and disappear. Victor dies, Walsh dies, the 3 other victims die, and the network stays hidden. Emma looked at the clock. 10:23. They had 1 hour and 37 minutes to either secure Victor completely or move him to the federal facility while protecting him from ambush. Bennett's radio crackled. Dr. Bennett, the mass casualty in the ER, it was a false alarm. The bus accident never happened. Someone called it in using a spoofed hospital number. They were trying to pull you away, Cross said to Emma. Divide our defensive resources. When that failed, they'll try something more direct. The lights flickered once, twice, then died completely. Emergency lighting kicked in, bathing the corridor in dim red glow that turned the medical centre into something from a nightmare. They cut main power, Sophie said. That means they're coming now, while visibility is compromised and normal security systems are down. Emma's combat training took over completely. Sophie, position yourself behind the monitoring station. Clear sightline to the door. Maximum cover. Cross, your primary response if they breach. Bennett, get on the phone to your security team. I want armed guards at every stairwell and elevator on this floor." "And you?" Bennett asked. "I'm keeping Victor alive." Emma moved to the bed, positioning herself to provide both medical intervention and physical protection. Because if he dies, everything dies with him. The victims, the investigation, any chance of justice for Nadia and the 42 others from Aleppo. Footsteps echoed in the corridor, multiple people moving with coordinated precision, not evacuating hospital staff, not responding emergency personnel, something else entirely. Cross raised his weapon. "Whatever happens, nobody touches that witness." Through the dim emergency lighting, Emma saw shadows moving. 3 figures, maybe 4, advancing with tactical spacing that spoke of military training. They weren't hospital staff. They weren't random operators. These were professionals, and they were done with subtlety. The final assault had begun, and Emma Hayes, former major in the Army Medical Corps, realized she was about to fight the kind of battle she'd hoped never to face again, not in a war zone, but in a hospital, where saving lives and taking them might become the same desperate action. Victor's hand found hers, his grip surprisingly strong. "Thank you," he whispered, "for keeping your promise to Nadia." Emma's jaw tightened. The promise wasn't kept yet, but it would be. Even if she had to turn Sacred Heart Medical Center into a fortress and herself back into the combat surgeon who'd survived 3 tours in hell. The shadows in the corridor moved closer, and Major Emma Hayes stopped being the quiet temporary surgeon who tried to hide from her past. It was time to finish the war she'd started 6 years ago in Aleppo, and this time she wasn't going to let anyone stop her. 11:17 in the morning, 3 days after the confrontation, in Victor's ICU room. Emma sat in Dr. Bennett's office, exhausted but alive. The Bratva operatives had been arrested by federal marshals, who'd arrived during the power outage, catching Dmitry Sokolov and Andrei Volkov in a coordinated takedown that left no casualties. Viktor Petrov had survived. The 3 victims at the Seaport warehouse, including Dr. Jennifer Walsh, had been rescued. Alexei Morozov, the network's Boston commander, was in federal custody awaiting extradition to face charges in 6 countries. "Your techniques saved lives that night," Bennett said, placing a folder on his desk. "The board of directors has reviewed everything that happened. Your military background, your combat surgical experience, the way you coordinated defense while maintaining medical oversight." Emma waited, knowing what came next, either termination for violating protocols or something she hadn't expected. "We're offering you a permanent position." Bennett opened the folder, revealing a formal contract. "Director of Advanced Trauma Medicine. Full authority to implement combat medical protocols, develop training programs, and build a department that combines military and civilian approaches." Emma stared at the document. 3 weeks ago, she'd been a temporary surgeon trying to disappear into institutional anonymity. Now, she was being offered exactly what she'd spent 8 years training for, except in a setting where she wouldn't have to dodge mortar fire. "Why?" Emma asked quietly. "Why now, after I broke nearly every hospital protocol?" "Because you were right." Bennett leaned back in his chair, and Emma saw genuine respect in his expression. "I've been chief of surgery for 12 years. I thought I understood trauma medicine. Then I watched you manage a mass casualty situation while simultaneously protecting a witness from international criminals. That's not something you learn in medical school." He pulled out statistics. "In the 3 days since you implemented your triage protocols for the emergency department, our response time has improved by 40%. Patient outcomes in critical cases are up 35%. Other hospitals are already asking about your techniques." Emma thought about Nadia, about the 43 victims from Aleppo, about Dr. Jennifer Walsh, who'd been hours from death when federal agents stormed the warehouse based on Victor's testimony. "I need Sophie Rodriguez as my lead trauma nurse," Emma said, "and full autonomy to train staff in battlefield medical techniques without administrative interference." Done. Bennett didn't hesitate. What else? A partnership with the VA, Emma continued. Military medics transitioning to civilian medicine face obstacles that shouldn't exist. They have skills that hospitals desperately need. I want to create a pipeline that brings veterans into our trauma program. Bennett made notes. The board will support that. What about Victor's testimony? Will you be involved in the federal case? As a medical expert only, Emma replied. I've spent enough time in courtrooms. My job is healing people, not prosecuting them. A knock at the door interrupted them. Sophie Rodriguez entered, followed by Dr. Marcus Chen, who'd been one of the residents mocking Emma 3 days earlier. Dr. Hayes, Chen's voice carried none of its earlier condescension. I wanted to apologize for the comments, the assumptions, everything. What you did, keeping Victor alive while coordinating with federal agents, that was extraordinary. You didn't know my background, Emma said simply. Most veterans prefer it that way. Can you teach us? Chen asked. Those combat medical protocols, the way you assess trauma that civilian doctors miss. I want to learn. We all do. Emma looked at Bennett, who nodded. That's exactly what her new position is for. Training the next generation in techniques that save lives, regardless of whether the trauma comes from car accidents or combat zones. Chen left and Sophie moved closer. Dr. Hayes, I got a call from Dr. Walsh. She's recovering well. Wants to meet you personally to say thank you. Emma felt emotion tighten her throat. How is she handling the trauma? Sophie's expression showed understanding. The way we all handle it. One day at a time, with support from people who understand what she went through. Set up a meeting, Emma said. And Sophie, about that lead nurse position. I need someone who recognizes military medical patterns, who can coordinate with trauma teams, who understands the psychology of treating patients from difficult backgrounds. Sophie smiled. I accept, on one condition, you teach me everything you know about combat surgery. I served 2 years. You served 8. I want to learn from the best. Over the next 2 weeks, Emma's advanced trauma medicine department took shape. Her first training session drew 30 medical professionals from across Boston. She taught them to recognize trafficking victim indicators, combat injury patterns, and emergency procedures that existed outside standard textbooks. Dr. Bennett attended every session, taking notes like a first-year medical student. His transformation from arrogant department chief to collaborative partner had been complete. He publicly acknowledged that combat medical experience represented valuable expertise that civilian hospitals had been ignoring. Viktor Petrov completed his testimony, providing information that led to the arrest of 47 Bratva network members across 3 continents. The genetic database was seized, containing information on over 300 potential victims. Every person on the list received protection and notification. The 12 doctors on the target list, 8 of whom had died before Emma's intervention, became the focus of a memorial program. Emma established a scholarship fund in their names, supporting medical students interested in humanitarian work and anti-trafficking medicine. 6 weeks after the confrontation, Emma stood in the new Advanced Trauma Center, watching residents practice triage protocols under simulated mass casualty conditions. Sophie coordinated the exercise with military precision, her voice carrying authority earned through experience. Dr. Hayes? A young woman approached hesitantly. She looked Middle Eastern, maybe 20 years old, with careful eyes that spoke of difficult experiences. Can I help you? Emma asked gently. The woman held out a photograph. This is my sister Nadia. She died in Aleppo, 2019. A doctor held her hand, promised her that the people responsible would face justice. Emma's breath caught. The photograph showed the teenager she'd treated 6 years ago, the girl whose death had driven Emma to finish what she'd started in Syria. The woman continued. I'm Layla, Nadia's sister. After the network was destroyed, I searched for the doctor who'd been with my sister. The military files were classified, but Victor Petrov's testimony mentioned you, Major Emma Hayes, the surgeon who kept her promise. Tears streamed down Emma's face. I'm sorry I couldn't save her. Layla shook her head. But you saved others. Dr. Walsh, the 3 people at the warehouse. And now you're training doctors to recognize victims before it's too late. Nadia would say you kept your promise. They embraced, 2 women connected by tragedy and justice across continents and years. When they separated, Layla handed Emma an envelope. This is from the families of all 43 victims from Aleppo. We found each other after the network was exposed. We wanted you to know that their deaths weren't forgotten and that your work saved lives beyond the ones you directly touched. Emma opened the envelope. Inside were 43 letters, 1 from each family, expressing gratitude and sharing memories of loved ones lost to the Bratva's operations. That evening, Emma sat in her office reading each letter. The simple military watch on her wrist showed 11:43, the same time she'd been holding Nadia's hand 6 years ago, making a promise she hadn't been sure she could keep. Dr. Hayes, Bennett appeared in her doorway. I just received confirmation. 5 other hospitals want to implement your advanced trauma protocols. They're requesting you as a consultant to develop their programs. Emma looked at the letters spread across her desk. 5 hospitals meant hundreds of medical professionals trained to recognize trafficking victims, combat injuries, and trauma patterns that saved lives. It meant Nadia's death had created something that would prevent future deaths. Tell them, yes, Emma said, but the programs have to include anti-trafficking training and partnerships with veteran medical professionals. No compromises. Bennett smiled. I expected nothing less. For what it's worth, Major, you've transformed not just this medical centre, but how we think about trauma medicine entirely. The board is considering making advanced combat medical integration a national standard. Emma thought about the journey, from hiding her military background to building a career on it, from trying to forget Syria to finally completing the mission that had defined her service. Sophie entered with updated statistics. Trauma survival rates are up 53% since implementation of your protocols. Response times down 47%. And we've identified 2 potential trafficking victims in our ER based on the indicators you taught us to recognise. Both are now in protective services. 2 lives. Emma stood moving to the window, overlooking the hospital parking lot, where this had all begun 3 weeks ago. 2 people who won't become statistics because someone knew what to look for. Bennett joined her at the window. You know, when you first arrived, I thought you were just another temporary replacement, someone filling a gap until we found a real surgeon. I was spectacularly wrong. You weren't wrong, Emma replied. You just didn't see what I'd worked very hard to hide. Combat experience makes you valuable, but it also makes you different. Sometimes being different is isolating. And sometimes it's exactly what the world needs, Bennett said. Your difference saved Victor Petrov, rescued Dr. Walsh, destroyed an international trafficking network, and revolutionized how we practice trauma medicine. I'd say being different worked out well. 3 months later, Emma received news that Victor Petrov had been granted reduced sentencing in exchange for his testimony and cooperation, 10 years instead of life, with the possibility of parole for continued cooperation in dismantling trafficking networks. She visited him in federal prison, curious about the man whose appearance had changed her life. Dr. Hayes. Victor looked older, thinner, but his eyes showed something that hadn't been there in the ICU. Peace, perhaps, or acceptance. I heard about your trauma centre, about the doctors you're training. Nadia would be proud. Do you think about them? Emma asked. The victims? Every day, Victor's voice was quiet. I can't undo what I did, but I can make sure the information I provided stops others from following the same path. Maybe that's not redemption, but it's something. It's more than most people in your position would offer, Emma said. Your testimony has already led to 12 more arrests and the rescue of 43 potential victims. Victor nodded slowly. Then, maybe my life wasn't completely wasted. Maybe the last thing I do can matter more than everything I did wrong. As Emma left the prison, she realized that healing came in unexpected forms. Victor's testimony wouldn't erase his crimes, but it would prevent future ones. Sometimes justice wasn't about punishment. Sometimes it was about breaking cycles that had been turning for too long. Back at Sacred Heart Medical Center, her advanced trauma center had become a beacon for innovative medicine that saved lives regardless of where trauma originated. Military veterans found purpose. Trafficking victims found recognition. Doctors found techniques that civilian medicine had been missing. And Major Emma Hayes, who tried so hard to leave the war behind, discovered that she hadn't needed to leave it at all. She'd needed to transform it, to take the skills learned in hell and use them to prevent others from experiencing the same darkness. The war wasn't over. It would never be completely over. But for the first time since Aleppo, Emma felt like she was finally on the winning side. 6 months after Viktor Petrov's testimony dismantled the Bratva organ trafficking network, Dr. Emma Hayes stood at the podium of the American Medical Association's annual conference. The auditorium held over 2,000 physicians from across the country, all gathered to hear about the Advanced Combat Trauma Integration Program that had transformed Sacred Heart Medical Center. When I was serving in Syria, Emma began, her voice steady, I held the hand of a 15-year-old girl named Nadia. As she died, she'd been trafficked. Her kidney removed by people who saw her as nothing more than spare parts. I promised her that someone would stop the people responsible. The screen behind her displayed statistics. 12 trafficking victims rescued in Boston. 47 network operatives arrested internationally. 300 potential victims identified and protected through the genetic database seizure. But Nadia's story isn't unique, Emma continued. Every day, emergency rooms across this country treat victims of trafficking, combat veterans with invisible wounds, patients with trauma patterns that civilian medicine wasn't designed to recognize. We miss them because we weren't trained to see them. She clicked to the next slide, showing before and after statistics from Sacred Heart Medical Center. Trauma survival rates up 53%, response times reduced by 47%. 2 trafficking victims identified and rescued based on recognition protocols. This is what happens when we stop separating military and civilian medicine, when we acknowledge that combat surgical techniques aren't just for war zones, but for any situation where lives hang in the balance and conventional approaches aren't enough. The audience applauded, but Emma raised a hand for silence. She wasn't finished. Dr. Jennifer Walsh, who, many of you know, was one of the victims rescued from the Seaport facility, she spent 3 days believing she would die so her organs could be sold to wealthy clients. Today, she's back practicing medicine. She's here with us now. Dr. Walsh stood from the front row, and the applause was thunderous. Walsh, a 48-year-old emergency medicine specialist, waved briefly before sitting back down. Her presence was a living testament to what Emma's intervention had accomplished. But our work isn't finished, Emma's voice carried steel. Viktor Petrov's testimony revealed that trafficking networks operate in at least 15 major American cities. They're sophisticated, well-funded, and constantly adapting. The only way to fight them is to train medical professionals to recognize the signs before it's too late. Over the next hour, Emma detailed the Advanced Combat Trauma Integration Curriculum. Pattern recognition for trafficking victims. Emergency protocols adapted from battlefield medicine. Psychological support for doctors treating patients from difficult backgrounds. Partnerships with veteran medical professionals transitioning to civilian practice. Dr. Bennett, now a vocal advocate for the program, joined her on stage. 6 months ago, he said, addressing the audience, Emma told me her skills weren't normal. I thought it was self-deprecation. What I didn't understand was that different isn't deficient. It's exactly what medicine needs. He displayed a map showing hospitals that had implemented Emma's protocols. 23 facilities across 12 states, trauma outcomes improving universally, trafficking victim identification saving lives that would have been lost. But this is bigger than statistics, Bennett continued. It's about changing how we think about expertise. Military, medical professionals possess knowledge that civilian hospitals desperately need. By creating pathways for veterans to share that knowledge, we're not just improving patient care, we're honouring the service of people who've already given so much. After the presentation, Emma was surrounded by physicians requesting consultations, wanting to implement the program at their facilities. She coordinated with Sophie Rodriguez, who'd become the National Training Coordinator for the Advanced Combat Trauma Integration Initiative. Dr. Hayes, a young woman in military uniform, approached. Captain Sarah Lynn, Army Medical Corps, I'm finishing my service in 6 months. Your program is exactly the kind of transition pathway I've been hoping existed. Emma shook her hand, seeing herself 6 months earlier in the captain's determined expression. Where are you serving? Just returned from deployment in Eastern Europe. Medical support for refugee operations. Lots of trauma, limited resources, improvised solutions. Exactly the experience civilian hospitals need, Emma said. Send me your information. We're building a network of veterans who want to continue serving in new ways.
That evening, Emma returned to her hotel room and found a message from Layla, Nadia's sister. The video showed Layla standing in a newly constructed medical clinic in Syria. Dr. Hayes, Layla said, her voice emotional. This clinic was built with funds recovered from the Bratva operations. It serves refugees, trafficking survivors, anyone who needs care. We named it the Nadia Memorial Medical Center. Because of your promise, my sister's name represents hope instead of tragedy. Emma watched the video 3 times, tears streaming down her face. 6 years of carrying guilt, of wondering if she'd done enough, of questioning whether one person's promise mattered in the face of institutional evil. Now she had her answer. The next morning, Emma received a call from the Department of Defense. They wanted her to consult on a new program integrating combat medical techniques into training for deploying surgical teams. The work she'd started at Sacred Heart Medical Center was expanding beyond civilian medicine, back into military operations. It's come full circle, Sophie said when Emma shared the news. You left the military to escape combat medicine, but you ended up revolutionizing it. I didn't escape it, Emma replied. I just learned to apply it differently. Combat medicine isn't about warfare, it's about operating under impossible conditions and refusing to give up when everything seems hopeless. 3 weeks later, Sacred Heart Medical Center hosted the first annual Advanced Combat Trauma Integration Symposium. Over 500 medical professionals attended, including veterans transitioning to civilian practice, trauma surgeons seeking advanced training, and administrators implementing new protocols. Viktor Petrov participated via video conference from federal prison, providing insights into trafficking networks that helped medical professionals recognize victim indicators. His testimony had been so valuable that his sentence had been reduced to 8 years with possibility of earlier release for continued cooperation. Dr. Hayes, Victor said during his presentation, I can never undo the harm I caused. But if teaching doctors to recognize victims prevents even one person from experiencing what Nadia did, then maybe my remaining years have purpose. The symposium concluded with a memorial service for the 12 doctors who'd been killed by the Bratva network. Their families attended, sharing stories of loved ones who dedicated their lives to fighting trafficking and paid the ultimate price. Emma spoke at the service, her voice carrying the weight of promises kept and missions completed. These doctors saw suffering that others ignored. They spoke for victims who had no voice. They refused to accept that evil could operate unchallenged in the shadows. She paused, looking at the photographs of 12 faces, people she'd never met, but whose deaths had driven her to finish what they'd started. Their work continues through every doctor we train, every victim we identify, every life we save using the knowledge they fought to preserve. They didn't die in vain. They planted seeds that are still growing. That night, alone in her office at Sacred Heart Medical Center, Emma updated the memorial wall she'd created. 43 photographs from Aleppo, 12 doctors from the target list, and in the center, a photograph of Nadia that Layla had provided. Beneath Nadia's photograph, Emma had mounted the letter the teenager's family had sent. The promise had been kept. Not perfectly, not completely, but genuinely. A knock interrupted her reflection. Dr. Chen entered, looking exhausted but excited. Dr. Hayes, we just identified another trafficking victim in the ER. 17-year-old male showing surgical scars consistent with organ removal attempt. He's terrified, won't talk to police. But he responded when I used the trauma-informed approach you taught us. Emma grabbed her tablet. Show me his charts. Let's make sure he gets every resource he needs. As they walked toward the ER, Sophie joined them. The trafficking victim from 3 months ago, the woman we rescued, she just sent a message. She completed nursing school and wants to work in our trauma centre, wants to help identify other victims. Emma felt the familiar weight of responsibility settling across her shoulders. But now it wasn't burden, it was purpose. This is how we change the world, Emma said, one life at a time, one doctor trained, one victim recognised, one promise kept. The ER buzzed with evening activity. Somewhere in that chaos, a 17-year-old boy was experiencing the first moments of safety after unimaginable trauma. And he had people who knew how to help him, trained by a combat surgeon who'd refused to let her past define her limitations. Major Emma Hayes had finally learned that running from war didn't mean peace. It meant finding new battles worth fighting. And this battle, fought in hospitals instead of combat zones, with medical knowledge instead of with medical knowledge instead of weapons, was exactly where she belonged. The emergency room doors opened, another patient, another opportunity, another chance to keep the promise she'd made to a dying girl in Aleppo 6 years ago. Emma's war hadn't ended, it had transformed, and she was just getting started. What would you do if your past refused to stay buried, when the skills you tried to forget became the only things that could save lives? These are the choices emergency heroes face every day. If this story moved you, there are countless other heroes working in hospitals, ambulances, and emergency rooms right now. Their stories deserve to be heard. Their sacrifices deserve to be recognised. And their knowledge deserves to be shared. By subscribing to Emergency Heroes Stories, you're not just watching videos. You're supporting the message that veterans, combat medics, and emergency professionals possess invaluable expertise that saves lives. You're helping spread awareness about trafficking, trauma, and the incredible work being done to fight both. What did you think of Emma's journey from hiding her past to building a career on it? Have you ever known someone whose different background made them extraordinary? Share your thoughts in the comments below. We value every person who takes this journey with us. If you want to see more stories about emergency heroes who change the world one patient at a time, hit that subscribe button and turn on notifications. We have more incredible true-to-life stories waiting for you. Until we meet again, remember, sometimes the heroes who save us are the ones who've been fighting battles we never knew existed. Thank you for being here with us tonight. Claude can make mistakes. Please double-check responses.